My goal this morning is to turn upside down your concepts of dyslipidemia. The present understanding of the pathophysiology and treatment is really not optimal, and it's been somewhat misguided by some of the national committees that tell you how to treat dyslipidemia. So what I would like to do is give you what is now considered the scientific basis for all the mechanisms that actually cause vascular disease related to lipids, and also give you a new mechanism, 38 of them actually, with nutritional therapy, supplements, and lifestyle changes that actually can modify the vascular impact of dyslipidemia. What I'm showing you here is a new concept in how the offending insults damage the arterial system. There are numerous insults, but there are only three finite responses that the artery can have related to those insults. Those include inflammation, oxidative stress, and autoimmune dysfunction of the vascular system. All of the insults, whether it's a lipid problem, blood pressure, homocysteine, or diabetes, all react in the same mechanism. There are receptors that sit on top of the endothelium, toll-like receptors, pattern recognition receptors, and calveoli that are the signaling molecules that determine what are the downstream effects with the vascular system response to dyslipidemia. So the context today is to take this model and look at what lipids are doing to the vascular system, but also determine why is it the body responds with a dyslipidemic response, and is it really just something that's related to your genetics, or is it really more environmental? So this is the key understanding, and I think the breakthrough in dyslipidemia. The most common reasons for dyslipidemia are the three finite responses: inflammation, oxidative stress, and autoimmune dysfunction. But if you're honest with yourself and your patients, what you find is that 70% of the causes of dyslipidemia are related to underlying infections, underlying toxins, and micronutrient disease and inflammation. If you correct the underlying problems, the dyslipidemia actually will redefine itself and go back to normal. So dyslipidemia is a response to the insult. It is a protective mechanism which the body has to reduce the onslaught of whatever the offending organism, bacteria, toxin, or micronutrient might be. In other words, we create metabolic and infectious endotoxemia on a regular basis. The body responds with a lipoprotein innate immune response. Lipoproteins then actually prevent infections. They're part of your innate immunity. They also protect against toxins. These lipoproteins basically detoxify the bacteria, the LPS, the cell walls of gram-positive and gram-negative bacteria. They also, in that response, as a defender of your vascular system, they become damaged. So your LDL becomes oxidized. Your HDL becomes dysfunctional. You mount an increase in LDL response, an increase in HDL response. So the increase in lipids, the increase in particle number, the changes in functionality, the changes in modification of LDL are a normal, regulated response that is correct, but it becomes dysregulated with time as continued infinite insults related to the vascular system, and the response is dyslipidemia. Basically what happens is the insults create a tsunami effect on the arterial system. The insult is in one location. Because the membrane is a fluid membrane, the entire insult is carried throughout the entire membrane, and the end result is a totally damaged vascular surface. And once that happens, the signaling through the entire vascular system becomes downregulated and abnormal. So here's a scheme of how this would work. You have various infections, different types of injury, metabolic dysfunction, nutrition, toxins, directly related to modification of the lipids. In this case, we'll use oxidized LDL. The oxidized LDL, which is also modified through glycation and other things, has a specific receptor called the LOX receptor. It also attaches to pro-inflammatory receptors like the toll-like receptors, the pattern recognition receptors. It disrupts the calveoli, which are lipid microdomains that sit in the cell membrane. The calveoli are one of the key areas that contain nitric oxide. You heard Nathan Bryan talk about this earlier. If you disrupt that calveolar membrane, you automatically decrease the downstream signaling and reduce nitric oxide levels. This sets off a very bad effect through nuclear activation, and then you set off an event of inflammation.